Hello, everybody. This is Dr. Jody Pogue. I'm an audiologist with Connect Hearing. I'm located in our Denton, Texas office. And today we're doing a Q&A session, giving you the opportunity to ask an audiologist any questions you might have about your hearing health or anything related to that. So I'm here to answer your questions, and you can go ahead and type them in, and I'll do the best I can. But for right now, I do have a few questions that were sent in ahead of time. So while I'm giving you the opportunity to type, I'll go ahead and start addressing some of those. First thing I'd like to mention, or the first one I'd like to go to is it safe for us to come to your clinic? That is a very important question, especially right now, because everybody is stuck at home and there's a lot of strange and scary stuff going on in the world right now. So we want you to know that we're doing everything we can to make sure that our staff, as well as all of our patients, are safe and able to come in and get their hearing health taken care of. So let me tell you what we're doing. First off, if you have hearing aids currently and you need them to be cleaned or repaired or have any kind of maintenance done on them, we're all remaining open, and we're offering services like that curbside. So that is minimizing the contact in order to keep everybody more safe, but at the same time making sure that we're accessible to you to take care of your needs. But in addition to that, there are a lot of people that need more than just curbside service on their hearing aids, whether it's to obtain new hearing aids, to be able to communicate with their loved ones or over the phone during this time, or need their hearing aids reprogrammed or fine-tuned. So we are allowing people into the office, but this is what we're doing. We are keeping the clinic's doors locked, and then we're only allowing people in by appointment, and one patient with one immediate family member can come into the office at a given time. And during that time, we're using all of the protective equipment, like masks and glasses or goggles and gloves, to make sure that we're minimizing, again, contact. And then we're also spreading out the appointments and allowing adequate time between in order to thoroughly sanitize the environment, all of the equipment and all of the surfaces that have been touched. So we also have a few other things that we're doing. We're offering some home delivery in some areas of hearing aids. So that's something that you would want to call your local clinic for to find out if that's available and how that might work for you. We're doing what we can to follow the local guidelines. So if you have questions about that, please call your local clinic. But yes, I would say that it is in fact safe for you to come to a Connect Hearing office right now. And more so, I'm going to say it's important to come to your Connect Hearing office right now, because we need to make sure that your hearing health is being taken care of. All right. Another question that we received was, are your center hours remaining the same? Well, yes, they are. Right now, the clinic hours are remaining the same. If there's going to be a change, you can find that change either on Google or Facebook, or you can just call your local center to ask. All right. Oh, here's a fun question. Okay. Can I connect my hearing aids to the television? So let's get off the whole coronavirus thing and let's talk about some fun stuff. So yes, you can, and that's super exciting because we all know that that's probably one of the biggest issues when it comes to having a hearing loss. In fact, if you're living with other people, it's not just a problem for you, it's a problem for everybody in your household. Because so often you'll have, a couple who have, one of them has hearing loss and the other one doesn't. So then the TV is a whole lot louder than one person wants it to be, and that can be really problematic. So with the newest hearing aids from Phonak, they're the Marvel hearing aids, they have Bluetooth right in the hearing aids. And what that means for television is that you just have a device called a TV connector that you just plug into your television. And that allows the audio from the TV to stream right through the hearing aids. The problem that's inherent with watching television when you have hearing loss is a couple of things. First off, the sound has to come out of the speakers on a TV, and TV speakers just aren't the best. And then that sound has to travel from wherever those speakers are to wherever your ears are. And as it travels through all that space, it diminishes in power, And it also mixes with all the other noise in the environment. So what we do with these Marvel hearing aids is we bypass all that. So instead of the sound coming out of the speakers on a TV, the sound is coming out of the speakers in your hearing aids. And then it's not mixing with anything because there's no noise in your ear canal. So you have this beautiful quality of sound, and you can understand the crisp, sharp speech that's coming through the hearing aids. But even better than that is if, say, everybody in the house has gone to bed and you want to watch TV by yourself, you turn the TV all the way down and nobody has to hear it but you. And I can hear a bunch of wives and husbands out there going, yay! But if you're watching TV with somebody else, then let them control the TV volume so they can have it at a volume that's comfortable for them, and you can still hear exactly what you need to hear through your hearing aids. So this Bluetooth capability in these hearing aids is tremendous, and you will love it. Okay, what other questions do we have right now? All right, how can I get batteries? Okay. A lot of people are not using hearing aids that have batteries these days because so many hearing aids are rechargeable. If you do still have hearing aids with batteries, one, you might want to talk to your provider about rechargeable hearing aids. But if you're still using hearing aids with batteries and you need to get some, there's a couple of different ways you can do that. You can come into any clinic and get them curbside, just like I was talking about earlier. Or you can just call the clinic. And if you are part of the Connect Advantage program and you get free batteries, then we can send those batteries to you. You would just need to pay a small shipping charge. And if you are wanting to purchase batteries, you can purchase them over the phone with a card, also pay the small shipping charge, and we will send them to you. So a couple of different ways so you can make that happen. All right, got another question here. What happens at a typical appointment at Connect Hearing? Okay, so this is what we do. The most important thing we do when somebody comes into the clinic is we need to get to know you. So it's very important that we do a thorough discussion. I mean, it really is an opportunity for us to learn exactly what your situation is. Not just where you're having trouble hearing, but also about your day-to-day life, because there are so many different options out there in hearing aids. So we need to just talk to you about what your difficulties are and about where you go on a daily basis, what your environments are that you go into, what they look like, what they sound like, and what your family members are experiencing, all of these different things. So we're going to start by just really getting to know you. And again, that's the most important part of any evaluation. But after we've done that, we'll give you a good idea of what to expect for the rest of the appointment, which would include doing what we call otoscopy. That just means we're going to look in your ears. And if there is wax and we need to get that removed during a normal time, we can remove that. Right now, because of the virus, we're restricted on that. But I think that restriction will probably be lifted, soon. So we'll see about that. But we will do otoscopy, and then we will put you into our sound booth and do a complete comprehensive hearing evaluation. And then, after the evaluation, if you do have a hearing loss that warrants hearing aids, we're going to put some hearing aids on you, which is super exciting because it's not just a matter of making a decision based on information that we're telling you. We're going to let you hear it. We're going to let you hear the difference and what changes it can make in your ability to communicate and hear the world around you. So we'll let you hear what hearing aids sound like, and then we'll give you an idea of what your options are in terms of pricing based on your budget and your lifestyle, and let you make decisions from there. All right, what other questions do we have? Let me see. Oh, okay. I am an EMT and I'm not a Connect Hearing client. My hearing provider is closed. Can you help with the hearing aid I need fixed for work? Yes, I'm so glad you asked that. First responders, healthcare, and supermarket workers are our first priority right now. So just call, set up an appointment, and we will, in fact, take care of you. All righty. Good questions. What other questions do we have right now? We've got just another minute here. So let me see what else I can tell you. My mother is isolated in their retirement home. Can I drop off or pick up their hearing aids that need repairing? Yes, you can do that. We'd be happy to coordinate with you to make sure that we can service the hearing aids for them as well. All right. think we're just about done with our time. Does anybody have any final questions that I can answer before I sign off? All right, well, I don't see anything else. We'll be doing this again soon. It may or may not be me, but I hope all of you have a blessed day, and please let Connect Hearing help you with your hearing health. Take care. Oh, wait, I have one more question. Let me go ahead and answer that before I sign off. What help can we have from a payment or finance point of view as money is tight at the moment? Oh, it is indeed. Okay, so we do work with financing companies. We work with Care Credit. It's a medical financing company, and we have options for no interest or longer terms with fixed rates. So we can help you get established with that, and you can certainly pay out the cost of hearing aids over time. It's not something that has to be done all at one time. So excellent question. Okay, very good. All righty. We'll see you next time. Bye-bye.